My name is Moinuddin Syed and I'm a cardiologist at Prisma Health. I'm originally from India. I went to med school in India, then I moved to the US and completed my medicine residency at the Cook County Hospital in Chicago, Illinois. I did my cardiology training at West Virginia University in Morgantown. Then I moved to Boston, where I finished a year of training in interventional cardiology, and then moved to New York City, where I finished my vascular and endovascular training at the Mount Sinai Hospital in New York City. I specialize in taking care of patients with blockages in the heart arteries, whether it's patients with acute heart attacks or patients with chronic blockages who present more with chest pain, with exertion, or shortness of breath with activity. What we do is we do minimally invasive procedures with catheters. We go through the wrist or the groin and open those blockages with the balloons and stents. And most patients go home the same day. And I also take care of patients with blockages in the leg arteries, especially patients with the pain in the legs when they walk, or tiredness or fatigue in their legs when they walk, or even patients with chronic wounds and ulcers, or those who've had prior amputations. They usually have blockages in their leg arteries, and what we do is we do minimally invasive catheter-based treatment to open the blockages in the leg arteries and improve the blood circulation to the legs. And the goal is to prevent amputation and help them relieve their symptoms with pain or discomfort with walking. Early in my training, I took care, during my residency, I took care of patients with acute heart attacks, and I was just fascinated with the impact we could have on patients' lives, especially those people who come in with acute heart attacks, and being able to open the acutely blocked arteries and help them relieve the chest pain. I felt that this is a field where you can make an immediate impact on their lives and help a lot of patients. And even taking care of these patients long-term in the clinic after their acute issue is resolved, whether it's managing them with medicines and following them and taking care of them long-term in the clinic it helped me provide long-term, longitudinal care for these patients. Though I'm a proceduralist, I like doing procedures in the cath lab and in the hospital. My focus is always on prevention of disease so that patients don't need these procedures. I always try to educate patients on how to take care of themselves, whether it's getting daily physical activity, eating healthy, avoiding smoking, and taking care of their diabetes, taking the medications for blood pressure, and following up with their primary care physician, and eating healthy. So these are the main components I focus on in the clinic. I like spending time with my family, and I like outdoor activities. I like to go on hikes, and I like cooking. Believe it or not, after a long day at work, cooking really de-stresses me, and whether it's 8 p.m. or 10 p.m. when I get home, I always like to make a meal at night, and that helps me de-stress. If you want to make an appointment with me, please call the number on the screen.